To start, I will say that developing public health ethics practice in the US has been about 20 years in the making. So 2 decades, not 2 years, 2 decades of moving this forward. It has been an incredibly fulfilling experience, and the work is not finished yet. So I will start by just sharing a little bit about what it is we're teaching, what are we talking about when we talk about public health ethics, what skills we are trying to inculcate for public health professionals, and then a little bit about how we are integrating things into our practice. So I will talk a little bit about the engagement across the entire public health sector, not just our CDC and not just in our academic settings, but all across the public health sector. And very importantly, how we have been trying to create demand for public health ethics. So people ask for this training and ask for this kind of expertise. So I'll just start with what it is we're teaching. So to do this, we have to take one step back, and that is to really think about what is bioethics. In the early 1970s, the very first modern use of this term was by von Rensselaer Potter, who was at the University of Wisconsin in Madison in the US, and he described bioethics as the marriage of biology and the humanities, and science and the humanities, a very wide view of what bioethics is. And he thought that the world would be a terrible place if we didn't think about how to integrate the humanities into what we're doing with science and technology. And so he put forth this model that we would think about things like environmental health, the health of the ecosystem, health of animals, health of humans, health of the planet. And he, at the same time, there was another model of bioethics being put together by Georgetown University and Andre Helligers. They were very focused on clinical medicine, clinical health care, and the ethics around individual decisions about dying, about the beginning of life, the end of life, about care, the amount of care we give people in their last 6 weeks of life versus how much health care we give people in their 60 years of life, these kinds of things. In the end, the Georgetown model won, and that is where bioethics has been since the beginning in the US. We are trying very hard to think more broadly about bioethics as an umbrella term. And we know that clinical and medical ethics has a very well-developed theoretical basis. It has a very, there are many books and much literature written about the individual health decisions and the ethics of those health decisions. Research ethics, of course, has taken on its own place in bioethics, rightfully so, thinking about the risks and the benefits for research participants and how a research participant is engaging in risk or taking on risk for the benefit of someone else. A little bit different than clinical medicine, where you take on risk for your own benefit, so some differences. And of course, those two have really been where the bulk of funding for bioethics development has been in the US, and where most bioethicists have gotten their training and also have done their work. What we've been trying to do for the last 30 years or so is develop this field or this subfield of bioethics called public health ethics. And then of course there's the environmental ethics folks as well. In public health ethics, in environmental ethics, as well as the others, the values that motivate us, the principles that we care about are different than those in medical or clinical ethics. And often we have, unfortunately, conflated the term bioethics with clinical ethics. So if I go to to a conference, and I introduced myself as a bioethicist, which I am. I'm trained in both epidemiology and in ethics. And I introduced myself as a bioethicist. People ask me, oh, what hospital do you work at? And I say, no, not that bioethics. I'm actually in public health ethics. So what we're trying to do is really recalibrate this understanding of where bioethics is. My area is in public health ethics, and I understand that the things we value in public health, the principles we use to make tough decisions in public health, are very different than they are in clinical medicine. This was our first hurdle to get the whole population of bioethicists to understand that, and then also to get people in who do public health practice to understand why it matters that we make decisions that are thoughtful and reflective. So when I say the words public health ethics, when we talk about public health ethics from these last 30 years, we're really talking about two things. We view public health ethics as both a noun and as a verb. So let's talk about what that is. The noun part of public health ethics is really the moral governance of what we do in public health. What are the values we care about in public health? How are they different from the other kinds of bioethics? And also, when we think about a decision where values are in conflict, how do we know which of those values we are dealing with? That comes from the things that the profession of public health values, not what the people in public health value. So we'll talk a little bit about that in a second. So that's the noun part. The verb part of public health ethics is how we go about making reasoned decisions about how to move forward. We know in public health the classic conflict is autonomy versus the greater good. That's one, but not all, of the value conflicts in public health. And when we are in that situation, the question is how do public health professionals decide which way to move forward? And so they have to learn how to reason through questions of that where values conflict, particularly because in public health policy, we are making decisions for other people's actions. So in some ways, that's similar to research ethics, where somebody does something for the benefit of someone else, right? Which is different still than clinical ethics, where I take on risk for my own benefit. So in public health, because Lisa, I am not deciding what I'm going to do. I'm deciding what all of you should do, whoever you are, whoever the population is. And so I must be able to do that in a way that considers what you value, not just what I value. And so this is how we introduce the idea of public health ethics to public health workers. We are dealing, when we talk about what is that noun part, what's the moral governance of public health, we recognize as professionals we're dealing with this public good, where we have to shift from our own individual moral compass. I know what's right for me. I've thought very carefully about it. You all know what's right for you. And they're probably not exactly the same. That's fine. But when I am making decisions for other people, I can't use my moral compass. What I have to use is the moral compass of my profession. And that is where this moral governance comes in. I have to know, what does my profession profess to care about? And what does my profession promise the public that they will do? And that is what I have to know, and that is the moral governance that I have to think about. And then when I have that moral governance situated, and I know what I'm promising to do for the public, I have to think about how to make decisions when these values conflict. So that's what we think about when we think about how to teach public health professionals about public health ethics. So how did we get there? Well, we started with some theoretical development in the literature in the early 2000s, where individual academics thought about public health ethics and started writing about it. And then what we decided to do was in the about the 2010s or 2014, we thought maybe what we need is to have a list of agreed upon principles and values for our profession. We need to tell each other what we expect from each other, and we need to tell the public what they can expect from us. And that is where, when we decided to do a national deliberation about what are the values of public health. And that would then develop into what is our moral governance. And that is in this document, and many of you have seen this. This document was spearheaded by the American Public Health Association. That is an association of public health professionals from all over the country. It's about 50,000 members, so it represents all different kinds of public health professionals: laboratorians, epidemiologists, county and state and regional health officers. People from all areas of public health belong to this organization. It's not a governmental organization, it's a professional organization. So it has leeway to do a lot of things that governmental organizations can't do, including lobbying and advocating and putting out documents that say this is what we believe. And that's what this document does. So after about 4 years of talking with various governmental agencies, NGOs, membership of this organization, we summarized what we heard as the 6 foundational values of public health, what our profession cares about. These are not in any order, so they're not numbered, but one doesn't take precedent over the other. They're prima facie values. But we talk about these 6 values as driving everything we do in public health. So they're listed here. They're also in this document. Many of you have read that. Just to summarize, we know with professionalism and trust, for example, all the work we do in public health, we really recognize that trust is our currency with the public. The public has to understand that we have their best interest at heart, that they can trust our evidence, that they can trust our motivations, these kinds of things. So acting as a professional and being trustworthy are critical pieces. Health and safety, obviously we care about health and the flourishing of individuals and communities. Health justice and equity is the cornerstone of what we do in public health. We recognize that without equity and health equity, we automatically then cannot have human flourishing or flourishing of communities. So that's a critical piece. And not just that we address or acknowledge health inequities, but that we promote health equity. So it's a little bit different than just observing it, but actually doing something about it. And the thing that most likely differentiates public health ethics from clinical ethics is this idea of interdependence and solidarity, that we owe each other things, especially when we start to talk about things like infectious diseases and other types of things, but even with chronic diseases and other injury prevention type work, the fact that the health of every individual is connected to the health of every other individual on this planet is really important for us to recognize. And this is a very different idea, a very different value than clinical medicine, where when you're at your doctor's office, your healthcare provider, what you want is them to have your best interest at heart, right? What is good for me? But in public health, we talk more broadly about how we together can create healthy and flourishing communities. That said, we also have to recognize that oppression at any level is, whether that's an individual level or a community level, is also hugely problematic for health. So health, human rights and civil liberties are critically important in public health. We have to recognize that. And finally, inclusivity and engagement, ensuring that we've actually engaged the affected communities that we serve. No one knows their experience better than a person who's experienced whatever it is we're working on. And we have to honor that and make sure that we recognize the values that they're bringing to the table in order to get them to participate. So these, after many discussions, we've combined into the kind of 6 foundational values of public health. Now there is room for argument about which is most important and all that. That's a different issue. This is just a list of what we think matters. Now, as you can recognize from this, several of these conflict, right? If you're talking about civil liberties and human rights, and then interdependence and solidarity, and there's a conflict all over the place. That's where learning how to manage those conflicts and to deliberate to a solution is the verb part of public health ethics. And why do we have to do something? Well, we have to do something because firstly, public health is a field of action. We don't sit around and think about interesting things. I mean, we do when we have time, which is very rare, but mostly we act. The public counts on us to do our duty of acting, to do the thing. So what goes into to decisions about public health action? 4 things. Evidence. What is it that's possible? What can we do? What does the evidence or the science tell us? How many of you have said public health is a evidence-based activity? We use evidence, we use science. Science is what matters. We are a scientific field. All true. But it's not the only thing that drives what we do. The other things that drive what we do are laws. We all know law is a really useful tool of public health. And sometimes it tells us we can't do things in public health, and sometimes it tells us we're required to do certain things. When something happens in a community that threatens health, it's public health who's legally obligated to go address that. So there are things we have to do and things we can't do. We have to consider that. We also have to consider the values. These are the questions about what we should do. So we know what we can do, what we are permitted or not permitted to do, and we have to think about also with our action, what should we do? What's the right thing for this community? Who knows what the right thing is for this community? Sometimes the community knows the best, and we have to make sure that we acknowledge that. And that's where bringing in lived experience is so, so important. So making sure that whatever policies we set up, whatever public health action we dictate, that it has been informed by people with lived experience is critically important. So when we talk about doing public health ethics, given that every action requires all these inputs, one of the things we have to ask ourselves is what are we proposing, and is that an ethical proposition? So 8 things that we came up with, again, this is in this document, but 8 considerations that should arise in every discussion about a public health policy are these things. We should ask ourselves, is this a ethically permissible intervention? Would this be ethically permissible even if, or would it be ethically impermissible even if it helped people? So sometimes there are things we can do to help our communities that just would not be ethically right. A very, exaggerated and classic example is, one human has 8 to 10 organs that could help 8 to 10 other humans who are suffering. Does that mean we think about, oh, this is a nice human, it's got some good organs, let's go ahead and take those from them, that will take their life, but it will make 10 other people healthy. We don't do that, even though it would be great for those other 10 people, because it's not ethically permissible to do that. So it's this very basic idea of, is this permissible? Is this action respectful of communities? How do we know that? Well, we only know that if we ask them, if we engage them. Reciprocity. Have we done everything we can to make this action that we're asking communities to take as easy as possible, to minimize the interruption of the lives of the people we're asking to make those decisions and those actions? Have we reduced the cost as much as possible? Does it work? This is where evidence comes in. We want evidence-based practice or evidence-informed practice. The problem with effectiveness is that sometimes we have no idea if the thing is going to work. And that's critically important when we talk about outbreaks. We've all just survived through the pandemic of COVID-19, and we didn't know at first what worked and what didn't work. So sometimes we have to struggle with the fact that we don't know. And how do we communicate that? How do we work through that? We all know that public health has low resources, is poorly supported in almost every country. So we have to think about responsible use of our resources. Is this the best way for us to spend our money? Because we don't have very much of it. Proportionality, are we responding with an intervention that's proportional to the hazard to our communities? Accountability and transparency gets to that very first value, which was professionalism and trust. If we cannot be accountable and transparent about how we made decisions, then there's no reason that the public should trust us. And so we really have to think carefully about that. And then finally, public participation. Have we invited the right voices around the table to help inform us of what this action should be? Now, all of this sounds like a lot of work for a single public health action and a single decision. We don't make all of our decisions in this way. That would be very inefficient. It would not be very helpful. It would impede our response in many ways. But when we can, we need to be thinking about how to use these approaches to making our decisions. We think, as we think about making these decisions, what is it public health professionals have to be able to do? Well, we think about this as 4 skills for ethical decision making. A public health professional has to be able to identify what the ethical dimensions are. Right? If you can't even identify what the values might be or where the conflicts might be, it's a problem. You just go forward and think you're doing the right thing. So helping public health professionals think about and reflect on what are the values here, what are the values of our community, how do we make sure that those coincide and make sense together. The second piece, the second skill set that a public health professional has to do is to be able to articulate, to say to the public, what are these ethical dimensions, where are the conflicts, and how did we deal with those? So in the case of masking for COVID, for example, we might say, we don't know if masks work or not. We're not sure, the evidence isn't there. We're in week 2 of COVID, we don't know. But wearing a mask is pretty easy, and it might help. So we thought, we don't really know, but it's worth the precaution if it does save lives. And that's how we came up with this policy that people should wear masks. That's a very different message than telling people you must wear a mask to come into the grocery store. And we didn't do that very well in COVID, right? We weren't transparent about what we knew and didn't know. We didn't take into account the values that some people would find that offensive to wear a mask, right? But we have to be able to say that to our public. So articulating these ethical dimensions are really important to signal to the public that we understand values should be part of our decision and we consider them. The third set of skills that we think all public health professionals need is a decision-making model. How do we decide what to do when values conflict? Now, as I said just before, this model of deliberating and considering all these values and listing them all and considering these other aspects, this is not particularly efficient and it takes some time. But we have to be able to do that for the difficult decisions. We don't have to have one of these kinds of deliberations for the simple decisions. But we do when we think about asking communities to do things for their health that they might not understand or not want to do. And that is where we have to be able to present evidence so everybody can understand it. We have to be able to understand their lived experience and the values. So thinking about what is the best way to make the decision and then how to engage in that decision-making process is critically important for us to understand as public health professionals. And finally, like any good epidemiologist or any good public health professionals, we evaluate what we've done. So we have to implement our decision and then evaluate it. So next time something like this comes up, we've start to build, like in law, where in the US we have case law, right? Well, this case said this, and so we start to develop a body of understanding about what we did in other similar situations and how it might be different. So those are the 4 things. Identify the dimensions, articulate them, make a decision, and then implement and evaluate. These are the skill sets. Each one of these can take a long time to teach public health professionals depending on how much background they have in any of these. The key with this is that the method is reflective and participatory. It is cyclical. It is something that it isn't you make the decision and you're done. You have to be thinking about it. You have to reflect. You have to really get as many perspectives as you can around the table. It's multidimensional. It's not just about what does the science tell us to do. It's also about what are the values of this community. And then also to recognize it's open to revision when we get new information. We all learned this during COVID. Sometimes that new information is new evidence. Sometimes that new information is a different perspective of a affected community. We might get new inputs, and we have to stay open to revising our public health policies. This is hard work. Getting public health professionals to understand this and to implement this is hard work, and it's continuing to take us many years to do this. So how are we doing it? How are we making sure that public health professionals actually learn these things? It's very challenging to integrate this into public health practice, and we can't do this by ourselves. We engage the full public health enterprise, including our schools of public health, trying to get them to help state out loud that an ethical framework is an important thing to teach students of public health. We've had various success with this. Sometimes they are very much behind it. Other times they think it's too hard and put up their hands and say, we don't know how to do this. We very successfly have been working with the American Public Health Association, and specifically the section of that organization that deals with ethics. We've had various success working with the Council on Education for Public Health, which is the accreditation body for our Masters in Public Health and doctoral training programs. Sometimes they are supportive of having ethics in their competencies, and sometimes they're not. It just depends what feedback they're getting from their programs. And finally, you'll hear this afternoon a bit from my colleague from CDC, but CDC has been a critical partner in developing the ethical skills of their own workforce. So that's been a really important piece. Because they are the leading agency for public health in our country, many smaller health departments look to CDC for leadership. And if CDC is saying this matters and this is important and you need to know how to do this, then they will follow suit. So that's really an important partner for us. With respect to creating demand for these kinds of skills, we've worked extremely successfully with a group called PHAB, P-H-A-B, the Public Health Accreditation Board. This is a board in the United States that accredits small health departments, state and local health departments. And they have required now as a criterion for accreditation that health departments know how to identify and address public health ethics issues. So that has been extremely motivating for health departments. We've also worked with journal public health reports, as well as creating communities of practice. People who are interested in public health want to do this work, and we create ways for them to connect. So it's been a very broad effort to make this happen, and we will continue to make those efforts happen. So thank you so much.